Hello friends, today we are going to learn about one of the important clinical assessment method known as Glascowma scale. Let's get started. Glascowma scale or GCS is a way to assess the mental status of the patient in an organized way and a good way to communicate information about the patient with the receiving facility. The GCS takes into account three things: eye opening, verbal response and motor response. A perfect GCS is 15, and if your patient is dead, they get a GCS of 3. You can never have a GCS less than 3. Each part of the GCS is assigned a certain amount of points. Eye opening is out of 4 points. If the patient opens their eyes spontaneously, they get 4 points. If they open their eyes to verbal command, "Hey, open your eyes," you get 3 points. If they open their eyes to pain, they get 2 points. And if they have no response, they get 1 point. Verbal response is out of 5 points. If the patient is oriented and talking to you appropriately, they get 5 points. If they are talking to you, but confused or disoriented, they get 4 points. If they have inappropriate words, they get 3 points. And if they are making incomprehensible sounds, such as just moaning, they get 2 points. And if there's no response, 1 point. Next is the motor response, which is out of 6 points. If they obey verbal commands, "Hey, move your right hand," then they get 6 points. If they localize to pain, like you pinch their arm, and they try to grab your hand, they get 5 points. If they withdraw to pain, you pinch their toe, and they pull their toe away, you get 4 points. If they have decorticate posturing, they get 3 points. And if they have decerebrate posturing, they get 2 points. No response, 1 point. After you assess their eye opening, verbal response and motor response, you add their score together. And that number is called the GCS. Post your answer on the comment box. See you all in my next video. Thanks for watching.